but to your question about, what it is as a doctor who's, a fertility doctor who's going through it. I mean, I will say the hardest part was at the beginning of my fertility journey when I didn't have any children. And I was coming to the grips with the fact that I may not ever have children, right? I had a lot of setbacks at the beginning, the Clomid cycle, the not great experience with it, the realization I had to proceed with IVF, and then my IVF cycle had to be canceled, and then I had to have surgery. There were a few months there, if not, I mean, way more than a few months. There was a long period of time where I was taking care of patients, and I had to, not just show empathy, but have empathy for people who are coming in, let's say for their, second or third baby. And here I was trying to have my first.
Right.
But in the end, it's not about me. And then it was a good, I don't know, like muscle building of empathy, where I kind of like, it's one thing to have empathy when someone is clearly, doing worse than you, right? But if somebody's doing better than you and you're doing worse than them, how do you have empathy? And it really is about like separating yourself, right? Like I am there to support you and take care of you and give you the best care that I can, which also includes having emotional and psychological empathy. And in order to do that, I have to separate myself from you. So I'm not saying it was easy, but it definitely was a muscle that I did build up at the time, that I believe I was able to like use that practice in
other situations.
My practice now, and allows me that empathy because of what I built back then.
Right.